Hello, my name is Estefania Ramirez. I am going to talk about oral Relugolix for androgen deprivation therapy in advanced prostate cancer. Definition: Relugolix is a gonadotropin-releasing hormone antagonist medication which is used in the treatment of prostate cancer in men. From the pathological point of view, the patient with locally advanced prostate cancer is one in one the presence of adenocarcinoma of prostate with extracapsular invasion of seminal vesicles without lymphatic invasion and without metastasis verified.
What is advanced prostate cancer? Prostate cancer can spread from the prostate to other parts of the body. This is called advanced prostate cancer. If it spreads, it usually spreads to nearby bones, like the spine and pelvis, and to lymph nodes near the prostate. It can also spread to other parts of the body, like the liver and the lungs. You might hear these new areas of cancer called secondary tumours, metastases, or METs. It's still prostate cancer wherever it is in the body. So, how can prostate cancer spread? Prostate cancer can spread around the body in three ways: into nearby organs, through the bloodstream, and through the lymphatic system. Firstly, it can spread into nearby organs. For example, it might spread out of the prostate and into the bladder. Prostate cancer can also spread through the bloodstream. For example, it could spread through the bloodstream into the pelvis. And it can spread through the lymphatic system. The lymphatic system is part of the body's immune system, which helps the body fight infection. Prostate cancer can go into the lymph vessels and the lymph nodes, which are also known as lymph glands. It might then spread through the lymphatic system to other parts of the body. Advanced prostate cancer cannot be cured and it can cause problems. If prostate cancer spreads to your bones, it can cause an aching pain called bone pain. If it spreads into areas around the prostate, like your bladder or urethra, it can cause urinary problems.
Application in medicine. Relugolix, a GnRH antagonist which inhibits both FSH and LH secretion, causing a rapid drop in testosterone levels. And trial involving men with advanced prostate cancer, Relugolix achieved rapid and sustained suppression of testosterone levels that were superior to that with leuprolide, with a 54 lower rates of major adverse cardiovascular events.
And over the years, we've had LHRH agonists coming in different formulations, really started back from daily to monthly to every 3 months, every 4 months, 6 months, and even annually. Those LHRH agonists can be given subcutaneously or intramuscularly. And then we have an antagonist that was approved that is also given subcutaneously on a monthly basis. And now patients and physicians will have potentially an option of a once-a-day pill given with or without food orally. So I think that gives a great opportunity to be thinking about flexibility in terms of administration of a testosterone suppressive medication. On top of that, convenience, so that patients don't have to come into clinic on a regular basis and all the attendant issues with that, especially given some consideration now given the COVID pandemic and in terms of safety and convenience for patients. But also, we need to recognize the cardiovascular safety associated with this phase 3 trial. We've had reviews of this over the years. In 2011, the FDA put a warning on the LHRH agonist regarding the cardiovascular toxicity issues.
Diagnostic tests. A core needle biopsy is the main method used to diagnose prostate cancer. It is usually done by a urologist. During the biopsy, the doctor usually looks at the prostate with an imaging test such as transrectal ultrasound or MRI. Also use digital rectal examination and AC to perform tests that identifies the presence of nodules or changes in the size and consistency of the prostate. The prostate-specific antigen (PSA) for the acronym English. Transrectal ultrasound. Through ultrasound, the prostate gland is evaluated in various dimensions to identify growth or changes in the prostate. The ultrasound-guided transrectal prostate biopsy is a reliable producer to confirm or rule out to diagnostic of prostate cancer.
Hello, I'm Dr. John Lynch, and I'm a urologist and I specialize in treating patients with prostate cancer. Not only am I a doctor, but I'm also a prostate cancer survivor, so I know how scary it can be to hear your doctor say the word biopsy. In this video, we're going to go over the basics of a prostate biopsy so that you can feel informed and talk to your doctor about any questions that you might have.
In general, a biopsy involves taking a piece of tissue from the body to look at under a microscope. A doctor will determine if the tissue contains cancer or abnormal cells. The results of the biopsy can help determine the next best step in diagnosis or treatment. If your urologist has recommended that you get a prostate biopsy, rest assured that he or she has thoughtfully considered your age, general health, family history, ethnic background, as well as the results of other testing, such as how the prostate felt on the digital rectal exam and your blood test results that checked your PSA level. A prostate biopsy provides two very important additional pieces of information for your doctor and for you. It will determine whether prostate cancer is present and, equally important, which treatment options are appropriate for the type of cancer diagnosed. So, what exactly does a prostate biopsy entail? It's usually a quick 10 to 15 minute procedure that includes a rectal exam, an ultrasound of the prostate, and a biopsy of the prostate. Based upon your risk assessment determined by your urologist, your procedure may vary in the number of core specimens obtained and may include MRI imaging. During the biopsy, medicine is placed to numb the nerves that supply the prostate, so you should only feel some pressure but no sharp pain. It's a very safe procedure. However, it can be associated with some side effects. The most important side effect is infection, but only 2 to 4% requires hospitalization. An appropriate antibiotic will be given before the biopsy to reduce infection. Other side effects are blood in the urine, bowel movements, and ejaculation. The good news is that these may occur for only a short period of time after the biopsy.
It's important to remember that a prostate biopsy is safe and will help you and your doctor make good decisions about any necessary treatment options. Talk with your doctor about any questions or concerns that you have about your biopsy. For more information, go to the Urology Care Foundation's website at Urology Health.
Diagnostic of prostate cancer. Pros. Relugolix achieves rapid and sustained suppression of testosterone levels. 54 lower rates of main adverse cardiovascular events. Cons. The most common side effects of Relugolix are suffocate, increased glucose, increased triglycerides, muscle pain, decreased hemoglobin, fatigue, constipation, increased levels of certain liver enzymes. Issue applying in Ecuador. Prostate cancer is the most common cancer in men in some parts of the world, and also in Ecuador the survival has improved thanks to the timely detection of the disease. The rise increases with age, especially after age 60. Timely detection of prostate cancer is carried out in Ecuador. Medical history and physical exam, PSA blood test, genetic tests for some men with prostate cancer. Conclusion: advanced prostate cancer has an impact on daily care. Genitourinary neoplasm branch of the NCI Cancer Research Center called Relugolix an interesting option for men with advanced prostate cancer. Its role will be in men with advanced prostate cancer who also have cardiovascular disease. Relugolix is not the first GnRH antagonist approved by the FDA to the treatment with advanced prostate cancer. Thank you.